Hello, everyone, and welcome to our YouTube Live, where we are going to break down everything about Medicaid enrollment and talk about what is happening with the unwinding, what's going on. I'm sure you've heard some rumors. So Carla Martinez and I from Every Texan are here. We are going to clear it up for you. All right, you ready, Carla?
Yeah, let's
All
get
right,
started.
let's do this. All right, so Carla and I kind of want to take you back a little bit to talk about where this started, what happened, and why are we where we're at right now. So, because Medicaid unwinding, it is not what we want to think it is, right? When we're sitting around and we're waiting and we're unwinding a little bit after a day of work, Medicaid unwinding is really complicated. And so we're going to get into that. Let's go back a little bit in time, though. Let's go back to 2019. There was some good music playing. Avengers Endgame was the movie of the year. Everybody was doing that. Well, guess what? If you were on Medicaid, every year you had to go through a renewal process. You had to make sure, did you qualify? Did your income match? Did everything go according to plan? And you had to show up in person to make this happen. So let's go forward a little bit more. Everybody knows what happened in January 2020. The country basically went on shutdown. In January 2020, the public health emergency was passed. And what this did is this actually lessened some restrictions on things so that we could get some vaccines in place, COVID testing. A public health emergency is pretty common. Anytime you have a tornado, a fire, flooding, anything like that, your state or your county is going to declare a public health emergency. Now, the difference with this public health emergency is it was done on a national level. And that's why we all heard it. And that's why we all felt it. So it allowed for vaccines at home, for vaccines, for testing at home. And it also loosened the restrictions. And guess what? We can go and have telehealth now. So fast forward a couple months, March 2020, the Families First Coronavirus Response Act kicked in. And this helped you if you lost your job, if you were homesick. It also helped with some meal lunch plans for schools and being able to make sure that our kids, even if they were home, were still getting fed. So the beauty about about this act is what it did is it had a requirement in there for Medicaid continuous enrollment. So remember, we talked about at the very beginning that in 2019 and before that, every year that you were on Medicaid, you had to go get it renewed. Well, what they did is they stepped in, they said, nope, we're not going to make you guys do that. We're going to keep you in a continuous enrollment state. So for the last 3 years, everybody has been able to kind of stay on Medicaid without that annual renewal process. So this was supposed to end, though, with the public health emergency. So they said, when the public health emergency ends, Medicaid continuous enrollment is going to end. All right, let's fast forward again. December 29th, 2022, the Consolidated Appropriations Act came around, and so did a brand new sheriff. And he went and said, guys, I'm breaking y'all up. You're not going to end together. And they cried about it. And they went through a little breakup process. But here we are. The public health emergency and Medicaid, they are no longer linked together, and they are going to end on different dates. So what does that look like? So in May 11th of this year is when the public health emergency is going to end. March 31st is when Medicaid continuous enrollment started ending. Now, what does that mean? And what does that look like for everybody? Basically, everyone will need to renew their Medicaid. Now, a lot of questions around this. How do I do this? What does it look like? What if I don't qualify? And my buddy Bones, he wants to know, how are you going to renew that many people? Why is this so important? According to the Kaiser Family Foundation, since Medicaid happened, or since the Medicaid pause happened for enrollment, there has been an increase of 21.2 million people as of October 2022. This is huge increase, and this is nationwide. Now, the Department of Health and Families Human Services, they estimate that about 15 million people are going to be disenrolled and about 6.8 million are still going to be eligible. Why is this so important? In the state of Texas, almost 6 million people are currently enrolled in Medicaid, and this is an increase in 2 million people. They suspect, and Carla will break down some of these numbers for us a little bit later, about 3.7 million are estimated to be impacted. About half of the people who are on Medicaid coverage right now are on it because of the continuous coverage requirement that they did not have to get dropped off. So why didn't they get dropped off? So as they lost their job, as people qualify for Medicaid at all of these different places in life, right? And so if you didn't have to go renew and show that maybe you have a new job or maybe your income has changed, they went ahead and they left you on Medicaid. If you moved here from another state, you still stayed on Medicaid. If you had a child that was on Medicaid, you still stayed on Medicaid. So there were all these things that were going into effect as to why we were still seeing so many people enrolled in Medicaid. So it basically rolled out into two phases. Phase one was where they prepared for the renewal process and started sending out letters to everyone. And now we're in step two. And what we're trying to do is, that's why we're talking to you today. We want to make sure that you have all the tools that you need for any sort of coverage moving forward. In the state of Texas, this is how they are planning to end continuous enrollment. Now, this is supposed to be a 12-month process. The state of Texas originally said we're going to do it in 8 months, which is really scary, but they have actually walked that back to say now they are going to go ahead and do it in 12 months. So the first group that's going to be dropped off, and that's who we're really going to talk about today, are individuals that are most likely to be ineligible or transition to CHIP. So these could be pregnant women who may transition to Healthy Texas Women's, members who have aged out of Medicaid. This particular group are those that have aged out of foster care, is a great example of this group. And why that's so important is if you are aged out of the foster care system at age 18, you have Medicaid until your 26th birthday. If you were 25 years old during the pandemic and you are now 27 years old and you've been on Medicaid, you are automatically being dropped. And you're not even getting a chance to renew. They're going ahead and they are dropping you. Adult recipients who no longer have an eligible dependent child in their household, they are getting dropped. And when I say they're dropping you, you'll get a letter that says you no longer have Medicaid. The second group are individuals that are likely to transition to a different Medicaid eligibility group. And then if anyone has a waiver pending, they're going to be in that group as well. So, and then the third group, that is going to be everyone from the previous groups who didn't get dropped off. And there's going to be some in here that are still going to be eligible. We're going to talk about what that looks like too. So like I said, disenrollment is supposed to take up to 12 months. But how they're going to process 6 million people in 12 months is huge. So they must conduct a full redetermination on everybody. And so members are going to start getting these yellow letters in the mailbox. Now, part of the problem is that there's a lot of people that move around. And if they don't have your updated address, and you're not going to be getting this letter in the mail, members have 30 days to respond to this. And this is huge. I'm going to pass it over to my friend Carla, and she's going to talk to us a little bit about what the next steps are and what we can do.
Thank you for that up, Debbie. So, like Debbie said, we had some extra help for people to stay on Medicaid since 2020, but since 2020. So we're in 2023 now, and a lot has happened since then. So people moved. I myself have moved 3 times in the last 3 years. The state might not be able to find people if they don't have a good address for them. So we want to make sure that people have good updated contact information with HHSC, but that they also take the steps that they need to whenever they're trying to renew their Medicaid or apply for a different type of health insurance if they're eligible. So this first step, this just means that for the first time in 3 years, people can become disenrolled from Medicaid if they don't submit their paperwork or if they're not eligible anymore. So Debbie mentioned some big numbers. 5.9 million people are on Medicaid today in Texas. And over the next year, everybody of those 5.9 million people are having to renew their Medicaid coverage. That 3.7 million, about half of that Medicaid population, is people that have stayed enrolled in Medicaid, even though they maybe didn't submit paperwork sometime in the last 3 years, or they weren't eligible. The good news is that now HHSC, the state, does have to try to see if they can be eligible for Medicaid today, or see what other options that people may have for them. But the first step is just finding where people are. So these rules are changing, and what that means is that for the first time, somebody can lose their Medicaid in 3 years. Like Debbie mentioned, there are some special considerations for a special type of Medicaid that's for more foster care children. So this is a type of Medicaid for youth that have aged out of foster care and had Medicaid when that happened. They can keep their Medicaid up until they're 26. So like Debbie said, if somebody was 25 back in 2020, they could be 27, 28 now and still be on Medicaid. And so we do want to make sure that we get them some kind of coverage if that's an option to them. But anybody that is still eligible for Medicaid, maybe they haven't hit their 26th birthday yet, we want to make sure that they do keep their Medicaid and complete all the steps for that to happen. So the first step is to make sure that your contact information is updated. So we want to make sure that the state can find you. So whether that is an address, if you want to get a physical paper, old school mail address, want to make sure that that's updated with your Texas benefits in the state at HHSC. If you prefer to get your electronic notices through an app or through email, that's also an option. So you can turn on electronic notifications if that's the best way to reach you. If you're waiting around, a week or two before you check the mail, that might be a good idea. And check your renewal date. So even though the process is starting right now, individual people might have different dates that they are up for renewal. So even though this process is starting right now in April, you may not have to take an action until September or October, depending on your individual circumstances. So everybody's date might be a little bit different, but we want to make sure that you are informed so that you can take action whenever it's your time to renew. And then respond when you get a notice. So if the state's asking you for something like proof of income or some other type of paperwork, we want to make sure that you do respond to that. So you'll hear us talk about yellow envelopes. Debbie mentioned them a little earlier too. And these yellow envelopes have this bright red action required on them. So that means that, that there's an action it's your time to renew. The state's asking you for something. So you can update your Medicaid account right now, even if it's not your time yet, with any changes that you have had in the last 3 years, but what you have today. So Updated address. If you want to go ahead and update your job information, you can do that. If your family size has changed, if you have new members in your family, you can do that. When you get these notices asking you for some additional information, you do have 30 days to respond. So that's one of the reasons it's really important to keep it up with when it's your time to renew, so that you know when your paperwork is due. After those 30 days, you have a little bit of a window of an additional 90 days if you do lose your Medicaid to give more paperwork. But we want to make sure that we're staying on top of these deadlines. I don't think Remy has joined us yet. I can pause here to see if there's any questions.
So far, we don't have any questions. But one thing that we do want to talk to you guys about is how important the Your Texas Benefits app is. This is huge. So what I'm finding when I'm talking to quite a few people out there is that they don't have the Your Texas Benefits app updated, or they don't have it downloaded on their phone. And what they've done is they've actually been able to take quite a few upgrades on this. You're able to see your SNAP benefits, your TANF benefits are on the app as well. So why it's so important to have this is that previously what you would have to do is you would have to call 211 and you would have to let them know your change of address. Your Texas Benefits app, they make it so easy for you, and they have taken out a lot of the hard work for you so that you can go ahead and you can update everything through the app. If you are working with anybody and they do not have this downloaded, or they're saying that they're having a lot of problems, please make sure that this is one of the first things you ask them. Have you downloaded your Texas Benefits app? Now, I've also worked with quite a few people that they've maybe moved and they've done all sorts of stuff. And so we'll have to call Your Texas Benefits to get some of their information uploaded and changed. One particular person had moved from a group home into an independent living situation. So we did have to make a couple changes with insurance and also with the Your Texas Benefits too. So just keep that in mind. Really, really important that you make sure that everybody is on this. And you're able to take a photo, scan up the documents that you want, especially if you need a paycheck, if there's anything, everything can be handled right through the app.
Yeah, and I'll just add, if apps aren't your thing and you want to use the website can do a lot of the same stuff that the app can. The benefit of using the app is, you have it in the palm of your hand, but the website can do a lot of that stuff too. So the way that you can make sure that you get access to the website and the app is by first creating an account on Your Texas Benefits. If you already have Medicaid, you might already have an account. And you do have to go through a couple of steps to verify who you are with the website or the app, so that you can get what we call a full case access account. So that just means that you have the full functionality of the app on your phone. One of the other nice things about the app is that you can turn on electronic notices. So instead of having to wait to check that physical mail, you can go ahead and turn on those electronic notices. So whenever you have something waiting for you, you can go ahead and just look that up on your phone. So if you do have the app and you're able to log in, you can go ahead and log in, and this kind of shows you the step-by-step process of what screens you click on so that you can turn on those electronic notices. So if you were to log in, up on the top right-hand corner, you could click on your little profile and then go to settings, alerts, and paperless settings. And you can turn off to get alerts and also to go paperless. So you don't have to do both. You can do one or the other if you'd like to keep getting some of that paper mail. but that is an option for you on the app.
Carla,
Uh,
what are some issues that you've seen that people have had with the app?
with the app. So sometimes, periodically there are app updates and the website gets updated too. So sometimes it's down, usually happens on Sunday during the day. So if you can't get in the first time, you can try to see if you can get in another time. So you do want to make sure your app stays updated, kind of like you would any other app on your phone too. But the app really does make it a lot easier to check stuff on your account or to get some additional details about your case. I've seen a lot more issues when people try to call 211 to get some information about their case. So it would be a lot better if you had access to the app or the website to get some specific information about your case.
And Remy, we are going to kick it over to you to see if you can also tell us some updates about the app as well. I know that you've been intricately involved in a lot of the use of it. So if you could give us some good tips around the app and different things that we can find on it as well.
Yeah, absolutely. Hi to you guys. This last little screenshot that you have here where the good alerts on both of them is really integral to not missing any updates, because a lot of times those notices that you get in the mail will come days after you get that notification in your app. You'll be able to see the full letter in the mail, or I'm sorry, in the app, as well as be able to go and upload whatever documents they're asking for right there as well. So it's really a one-stop shop if you're comfortable doing all of it on your own, or if you're just updating a few things. And then that's where the navigators here at Centro Med and Enroll SA come in as well. If you're just getting started, a little bit overwhelmed and not really sure what to do or what you qualify for, we're able to help you run through all of the applications, whether it's for the marketplace health insurance, the SNAP benefits or Medicaid benefits, as well as any other programs here at Centro Med that you may qualify for. So this link here will take you straight to the website, as well as the QR code will take you straight to being able to make an appointment. And so there are appointments available near you, in office, as well as virtual and over the phone. So whatever you're comfortable with, we're able to get you started and make sure that we find the best fit for you.
Hearing me, I have a question. Whenever people come to you to make an appointment, what should they bring with them, or what should they be ready to come to you with?
Sure, that's a really great question. And when you make the appointment, whether it's over the phone with one of our navigators or online, you'll also get a quick snippet and a text reminding you what to bring. So it's really helpful. But you'll want to have any passwords or IDs that you have used in the past if you're renewing any type of benefits or any health care, any W-2s from the previous year, or what you plan on making in the future or for the next year is going to be really helpful in filling out these forms. And then any IDs or cards that you may have for anybody that's applying for the benefits in your home.
Thanks, Remy. And I think y'all help with the application process, but also if people have questions before it's their time to renew.
Yeah, absolutely. If you give us a call at 210-977-7997, you're able to get in touch with the navigator who'd be able to give you some quick tips if you have any questions that can be answered right away, but also be able to get you that 30-minute or 45-minute appointment where you'll be able to get those questions answered. You might find out, hey, this is a great time to reapply now, or let's get this file started so that way when it is time for you to apply, then you'll be ready to go. And so giving us a call or going to the website is going to be the best way to get your questions answered pretty much right away.
And Remy, can you tell me that number one more time? Because I'm going to type it in the chat for everybody.
Sure. It's 210-977-7997.
Thank you. And I would definitely encourage anybody that's even wondering if they should reach out to go ahead and reach out, because this process can get really confusing, and you might even get confusing notices as well before it's your time to renew. It doesn't hurt to go ahead and reach out to get some of that help available. That is free help as well, so it's not costing you anything. So we definitely do want to make sure that people who are still eligible for Medicaid keep their Medicaid, but there's also a couple of different options if that's not if Medicaid isn't still an option for you. So one of the things that Remy mentioned that CentroMed also helps with is healthcare.gov. This is a place where you can shop around to see what options you might have to buy some health insurance. There is financial help available for people that are looking on healthcare.gov, kind of on a sliding scale based on your income. But more than half of people in Texas that have a plan on healthcare.gov are able to buy a plan for $10 or less a month. So for a lot of people, this is very affordable insurance. And this is probably going to be a little bit more geared towards people that are no longer eligible for Medicaid. There is a period of time, well, if you lose your Medicaid because you're not eligible anymore, you do have any time period between the time you lose Medicaid up until July 31st, 2024, to apply for healthcare.gov. And this can also be 60 days before you lose Medicaid, if you know that that's coming for you. So definitely reach out to CentroMed and see what options you might have on healthcare.gov as well. Some people might be able to get health insurance through their job if their job offers you health insurance. There is also on our federal law, there's a 60-day special enrollment period after you lose Medicaid to get insurance through their job. But if that insurance isn't affordable for the employee or the people in the family, you might still have some options through healthcare.gov. Unfortunately, some people might not have an option for affordable health insurance. In Texas, we haven't expanded Medicaid. So there's some people that fall into what's the Medicaid coverage gap, where they make too much money to qualify for Medicaid, but not enough to get help paying for their monthly premium on healthcare.gov. In Texas, we do have a program that's called Healthy Texas Women that isn't health insurance, but it offers access to some health services like well woman exams and contraceptions. We do also have federally qualified health centers that offer resources for the insured, underinsured, and uninsured. I might be putting Remy on the spot, but do you want to talk about any of the services CentroMed offers?
Sure. I was going to mention that CentroMed is a FQHC, and so the programs that are offered there are based on a sliding scale. So you do have to be a patient in order to qualify, of course, for the program. So you go, you make an appointment, let them know that you're wanting to meet with eligibility as well. And depending on your time availability and the time of your appointment, will depend on when you're going to go ahead and have that meeting with eligibility, but you'll find out before even your first appointment what it is that you qualify for. So there won't be any surprises, and they'll be able to walk you through all of the services there. We do also have a SDOH team that would be able to help you find out any other needs that you may qualify for as well, whether housing, food security, things of that nature, in order to help make sure that you're set, not just in your healthcare, but all around being able to take care of you and your family.
Thank you, Remy. And Debbie, I think we're coming up on the end, but happy to answer any questions.
Yeah, thank you so much to both of you. I cannot state enough how important it is for us to really connect with people as fast as we can. I know there's probably still going to be a lot of questions around it. I put some information in the chat so you all can reach out as well. Don't forget to like, don't forget to subscribe. We'd love to bring you some more information on this as well, and to bring you videos that you want and live streams that you want to see. We have got a huge problem in the state with health insurance and access to care. And so being able to connect Carla and Remy on this call has just been fabulous. Centro Med has a ton of benefits. Also, UT Health, we also have a lot of benefits through them as well. If you are a student and live in San Antonio, and if you are on any of the Alamo Community College's campuses, you can actually go, and it doesn't matter if you're at Palo Alto, Northwest Vista, wherever, you can actually go and get seen by a nurse practitioner on the campus of San Antonio College or Palo Alto for $5. And if you have a hard time paying for that, then we will help you with those funds as well. Our goal is we want to make sure that we get you connected to access to care, and we're covering all those gaps. So really appreciate you guys joining us today. And please reach out if you have any questions. And if you know somebody who doesn't know exactly where they need to go for help, Enroll SA is perfect for them to start with. And we can really start going through, like Remy said, they have the social determinants of health screening, so they can see if there's needs that they have around food insecurity, housing, anything like that. They can go through and they can work on those screenings with them, and we can get them connected to where they need to go. Really appreciate you guys on today, and have a wonderful afternoon.